The overwhelming majority of our patients are happy after cataract surgery, but what about the ones that aren't happy? What do they need to know?
And I tell my patients, as long as you don't give up on me, I will not give up on you. We will walk through this together.
Nobody wants them to do better on the planet Earth besides themselves than we do.
And I think it's important to know that the surgeon is on your team. It is my absolute goal to bring you to a happy outcome.
So Blake, the overwhelming majority of our patients are happy after cataract surgery, thankfully, but what about the ones that aren't happy? What do they need to know?
I think the biggest thing that they need to do is be communicative with their surgeon, right? Or if they're being co-managed by an optometrist, make sure that doctor is taking care of them as well and answering all their questions. I think if you do have a problem that could be surgical, trying to do your best to, clarify exactly what the problem is as specific as possible is helpful. So if you just come in and just throw your hands up and say, I can't see anything, and I look down at the chart and you're 20/25, not perfect, but you're doing pretty well. It's like, well, gosh, you can see. And so what is it that's actually bothering you? That's important. I think it's also important to sort of distinguish in your mind, what is debilitating, right? Versus what is something that's a little annoying versus what is just something that I notice. Those are completely different things. And oftentimes when I'm talking to patients, I say, assuming that there's nothing serious going on, I say, well, the good news is there's nothing urgent or emergent here. I'm so happy about that because there are things that we are concerned about after surgery, inflammation, infection, all these things. You don't have those things. You have this thing over here, whether it's floaters or a little bit of a dry eye issue, whatever it is. I think that's important as well.
And I think it's important to know that the surgeon is on your team. I tell my patients it is my absolute goal to bring you to a happy outcome. And so it's tends to get in the way if a patient immediately thinks that the surgeon didn't have the best interest in mind for them and that they put themselves on a defense mode or an offense mode. And it makes it so that communication is hindered and the patient and the surgeon can't really guide each other through that process. And I find that communication is key. So when I have that established relationship with my patients, I tend to be able to gather better information from the patient. Then it puts me on the right path to be able to help the patient towards that outcome that they need.
Yeah, and I tell my patients, if they're upset or they have a problem, I tell them, as long as you don't give up on me, I will not give up on you. We will walk through this together. Sometimes I give them my cell phone number pretty commonly, and I tell them, anytime you want to see me, day or night, you come in and see me. You get a fast pass. And so, and I tell them, I don't do this for every patient. I do this for every patient who is having a problem, and that is so rare that I'm happy to see you as much as you want. And so I think that turns the temperature down. Patients understand that you're committed to getting them the outcome that they want. And I also tell them, I'm a human. I'm not a deity, and your eye is not a widget. There are limitations that we have just because we're human beings. We hate that. We want every patient to have a perfect outcome, but there are unfortunately limitations with what we can do. But I tell them, I will do everything humanly possible to get you to a point where you're happy.
Yeah, and honestly, I think cataract surgery is so successful, but even things that have a 1% chance of happening or a 0.1% of chance of happening when you're doing thousands of surgeries, like collectively we've done over 100,000 surgeries, you're going to see the 1%. If you go to a surgeon who's had a lot of experience, they're going to be able to recognize what that problem is and what the potential solutions are. So the more specific you can be about what issues you're having, the more it puts you and your surgeon on the same team to really help guide you to the solution. And so I think a lot of times patients come in and they're frustrated or afraid, and that fear is expressed as anger, which some surgeons maybe get a little bit defensive about. But if as a patient, you can try not to express yourself with anger and you can just try to be a little bit level-headed and tell your surgeon what's really bothering you, then you guys can work together to really find the solution, because most of these problems have solutions.
And if I can add that more and more there's co-management that happens in eye surgery, where the surgeon sees the patient for the consultation and does the surgery, and the patient chooses to have their postoperative care done by their primary eye doctor. And if a patient's not happy with the results, but the primary eye doctor's mission is also to really get the patient to the best outcome possible. But at any time, I tell my patients, if they feel that they really want an access back to their surgeon, the door is always open to them. It's like sending off our kids to college. It's, we want them to be independent, but they can always come home if they want to. And I tell my patients, you are always my baby after I do my surgery for you. And they, as like you, Gary, they have my access to me, whether it's through my clinic or through my cell phone. And it's amazing that patients can feel so much reassurance from that. But it's important for them to know, again, that our goal is the same as their goal, which is to get them to the best vision they want to have.
Yeah, I mean, I think that, patients may not realize how much we care. We know, but they may not know that we take them with us on vacation. We think about our patients that are struggling all the time. We have dreams about some of my patients that are having challenges. And nobody wants them to do better on the planet Earth besides themselves than we do. So I think that's critical.
Yeah. And it's definitely not just us. This is true of surgeons across the country. They have done years and years of training to be able to provide high quality level surgery. And most people that are in ophthalmology have chosen it because the outcomes are really good and patients are really happy and they like seeing happy patients. So if you're not happy, believe me, they want you to be happy and they want to work with you as much as they can to get you to that point.